Now, if you watch carefully here, this is a CT scan of the patient. I have uploaded the CT scan into this computer, and this based on this blueprint technology. Now, this CT scan, on the CT scan, I can choose where to place my new joint. I can choose whether I have to keep it slightly up, slightly below, slightly in, slightly out, at 10 degree, at 5 degree, or 7 degree. You can see that, the movement there. So I can literally play on the computer to choose the best possible position and again the best possible file size for a particular patient. I can check on the computer, so what is the best possible position or the best possible size of the implant that is suitable for this particular patient. Similarly, on the other side of the joint again, I can do that. Here, I can change the degree or angle. I can change the height. And I can check my choice whether it is suitable for this patient or not on this 3D model here on the computer. Now, with this, I can precisely plan the surgery based on the bones of this particular patient, irrespective of the fact that this patient I'm going to operate is a very small built elderly female or a very obese male, like let us say 100 and 150 kilos male or a very thin built 50 kilos female. It doesn't matter. Usually females have weaker and thinner bones, elderly females. So sometimes we have difficulty in choosing the size for them. So on this technology, with this technology, I can choose the sizes and positions, and in fact, how much bone to be cut and how much bone to be preserved based on this software.